The JAKARTA-2 study we conducted several years ago in patients that had failed Ruxolitinib. Now that study, the patients that had failed Ruxolitinib, it was really a heterogeneous group of criteria that at the time really wasn't overly rigorous. It had been shortly after Ruxolitinib had been approved. There had been patients who really had had a very brief duration of therapy with Ruxolitinib ahead of time. So we didn't feel that the criteria for entry fully captured the activity of Fedratinib. So we did a reanalysis where we defined Ruxolitinib intolerance or resistance in a more modern way, now with 8 years of hindsight with Ruxolitinib, at least 3 months of therapy and a certain amount of regrowth of either the spleen, symptoms, cytopenias, etc. And then second, we looked to evaluate the efficacy of Fedratinib in individuals that at least had 6 months of therapy. So in looking at that group, we were able to look at the larger JAKARTA-2 group and then move it down to a cohort of just under 70 patients that really filled both criteria. Clearly had failed Ruxolitinib through a rigorous set of criteria and had had an adequate try of Fedratinib. With that, we see an over 30% response rate for reduction in splenomegaly and improvement in symptoms in individuals that had been significantly pretreated with Ruxolitinib and had that Fedratinib therapy. So we thought that was very encouraging, particularly in light of the further development of Fedratinib now held by Celgene.